Members of the CSIS Commission on Smart Global Health Policy, led by Commission co-chairs Helene Gale and Admiral William Fallon, traveled to Kenya for a 3-day mission in August 2009. The delegation met with a broad range of actors, including U.S. officials, representatives of the Kenyan government, public health workers, non-governmental and community-based organizations, and individual beneficiaries of U.S. assistance. To get a broad sense of U.S.-Kenyan health partnerships and interventions at the provincial and community level, members visited Mombasa and the surrounding Coast Province, Kisumu and the surrounding Nyanza Province, and Eldoret in the Rift Valley. The delegation focused on a core set of questions, ultimately intended to inform the Commission's recommendations. Among the principal objectives were to better understand impacts on the ground of multiple U.S. investments in health, to explore possibilities for greater integration across the various strands of U.S. support, to better grasp the obstacles and opportunities for improving maternal child health, which in Kenya, as elsewhere, has remained an enduring and often neglected health challenge, and finally, to hear from U.S. implementers and Kenyan partners how best to plan for long-term sustainability and impact of current efforts.
Thank you guys for coming. Let me just do an introduction. My name is Sally Mohammed. I'm one of the co-founders of Carolina for Kibera. And basically Carolina for Kibera is an organization that was started in 2001. And thanks to the funding from Duke and UNC that we were actually able to do the building, the clinic that we are going to be seeing.
How are you? How are you?
The same way you guys came is the same way that every material one by one was brought to this site.
That's right.
Wow.
And it's 99% of the labor force was from this community.
This clinic is a joint Carolina for Kibera CDC effort. CDC has a number of staff based here because this is the center for one of their 2 major surveillance sites.
The fact that we are having a state-of-the-art facility in an informal settlement in itself makes it so unique. We are using a patient care system that is computerized. We have lab facilities that are very, very modern, very, very complete. The patients can come, be able to be checked in, see the clinicians, get laboratory investigations, diagnosed, and even get quality medications.
We followed a highly seasoned and trained local healthcare worker through a number of muddy back alleys and rusty corrugated huts. Finally found a house where it's her responsibility to do a household survey every 2 weeks.
Okay, there's like a list of the whole family's name just downloaded in this. So this is like a sister-in-law. Kwa hizi wiki mbili Daniel amekuwa na kikozi. So the reason we are interviewing the sister-in-law is because we were not able to find Daniel home. Most of the time, household heads leave very early, maybe 5 a.m. or 6 a.m. to find work. So most of the time we just find the wives.
So then are you going to go to nursing school or medical school someday? Huh?
I'm doing community development.
Oh, good.
She's a doctor.
Good,
She's trying to get everybody.
Yeah, and you? BA in
Sociology.
Ah, good. One of you needs to be good. Would you become a doctor for me, please? Would you become a doctor?
It's so important to be able to have data that allows you to understand what the real problems are. A clinic like the one that we saw that has the ability to collect that data, connect the dots and figure out what the real issues are, and then link services and resources to the biggest problems and really be able to better measure the impact.
The Tabita Health Clinic is really an outstanding state-of-the-art clinic with a laboratory support that is going to, I think, gain lots of community recognition, acceptance. It's really going to set the standard for policymaking.
Because of the conviction of wanting to give back to the community, it's humbling to work in Kibera someone can be able, because of you, to have a better tomorrow and be able to do his or her job better. I think for me that is gratifying.
They had a sense of community, they had a sense of mutual interest and involvement. They really felt that the healthcare worker and the facility behind the healthcare worker was really taking care of their needs.
In serving the Kibera community, I look at the slogan the CDC, their logo has. CDC is here to provide safer and healthier people. So at any time I wake up very early in the morning, I always tell my mind, I always think in my mind that I'm going to improve the health of the community that I'm part of. So when the community is healthy, I'm also healthy. That's why I wake up very early in the morning. Yeah.
People that are here are part of a CSIS commission that was formed up earlier this year, which is looking at what a long-term strategic approach on U.S. global health is going to look like. We have a special interest in looking at the maternal and child health issues, and so we're here today, and we hope we'll hear more about that from you. We're also looking at sort of the long-term issues around the sustainability and the integration of efforts, and what are some of the critical challenges in expanding your programs. What we've heard is that they have a very narrow, shallow funding base. Largely they're dependent upon the cash payments that are made by the women who come in here and deliver. That's what we heard.
Yeah, they pay. You don't have to be rich, but still it's quite an amount for the common citizen. Yeah, it's unique because it's the only hospital that is specializing with women only. That is, it takes care of women from conception until they deliver.
Yeah, I've been to different other clinics, but this one is very nice because when you come, you are attended to at a very good time. You get all the medicines and you are given quality products.
These are basically flour, which we give to the HIV positive mothers and fathers and the infants also. It meets 98% RD of the vitamins, and also it contains the nutrients that are required for optimal growth.
The providers here are clearly compassionate, well-informed. Also, it's important for me to learn as a person who's not a medical professional that it is possible for the children who are born to HIV-positive mothers to be negative.
We want to go and see where our acute rooms are. This is where we admit babies who are quite sick and they need intensive care units. So they finish the treatment, they are discharged to the mother.
So is it that the mother has gone then and
no,
the baby?
No. We don't release the mothers. Once they have babies here, you will see that if we release them, some will run away. So we don't release the mothers. We host them in the wards. They come and express their milk, feed the babies after every 3 hours.
Yeah, and this one, you know, it looks so beautiful, child, so apathetic looking, you know, just
not picked up.
Exactly. Yeah.
Did you ever want to take them home?
I always do. I always do.
Well, I think this is it's a baby factory churning out lots of babies and providing what appears to be good quality care. But I haven't got a lot of answers in terms of what is the management structure, what is the strategy of U.S. investments. But overall, I'm impressed with the fact that they seem to be doing a good job of keeping a lot of mothers healthy, reducing the transmission of HIV to mothers. But we will need more information to be able to adequately assess the mandate of this commission.
This drop-in center hosts majority of sex workers and MSMs. We have also peer education sessions conducted by our peer educators who are seated there.
We are trying to get people from the community to change their behavior. Some of them are traditional, some of them are ethical, which is one of the reasons why HIV and AIDS is spreading widely in Africa. I got into sex work when I was very young. I was an orphan. And I've seen it all, police harassment, clients harassing you, to not having money, not having a roof over your head. Most of the time, when you get a client who offers you more money, you will not use a condom. Your child is sick, hasn't gone to school, you haven't paid your rent, you don't have food. When someone offers you 10,000 shillings, you will take it. For the first month that we are dating, we will use a condom. 2 months, 3 months, and then oh, she hasn't been sick for a long time, haven't seen him coughing. Oh yeah, we can go without a condom. That is the reality. A few of us, with the empowerment and with the education and knowledge we've had, we can do that ourselves. We can change that. We have changed. But out there, that is still a very, very big challenge.
Those people that you need to reach to accept you and welcome the dialogue with you, how do you do that?
By being a role model. In the community before, I used to have maybe many partners, but now I've changed from many to one. If the community sees me doing that, they can copy the behavior. I recruit peers every day. All of them have training for TB and family planning and malaria.
I've gone to seminars on women leadership and human rights. I was able to implement the peer education program at an organization called SWEAT. It's also a sex work organization in South Africa.
I'm grateful that I've come out from the darkness into the light, whereby now I can really help others, especially my peers. It's not a matter like issues of sex, it's a matter of issues of life. You know, you can change and become another person, be productive.
We have formed a mini movement for sex workers where we can have an open space to discuss the issues that we face in regards to sexual and health rights. And I'm hoping that we will reach other parts of Kenya and also have a whole African movement.
I think across the world, there's been a renewed emergence of the concept of getting the community to function as health workers, to really start developing the concept of health within their community. We see it here in Kenya around people who've had HIV. In the United States, you can go to urban areas and rural areas and really see people who are really energized.
Na nimejitokeza kwa sababu moja, maana mimi mwenyewe niko positive na nilikuja nikakuta kuna umuhimu wa kujitokeza. Nilifikiria nilirudi miaka ya nyuma 202. Wakati huo kulikuwa kuna siri kubwa sana. Hata kama ni bwana wako amepimwa, asipokubali wewe uambiwe, hutaambiwa. Na ndio niposa nikafikiria kama hapo ingekuwa wazi, kama kufikia dakika ya sasa, hata mimi kirusi akingenipata. Nikaamua kujitoa mhanga. Kuongea pale popote ama kwa mtu yoyote status zangu.
Kuna wengine wanashindwa kwenda hospitali kwa sababu wanaogopa. Kwa sababu wanaona labda wakienda, hiyo ni stigma. Wakienda kupimwa watapatikana ni positive. hiyo pia inachangia.
Most of the people were afraid to come out and test to know their status, but now we can see most of them do. There's still a bit of stigma, but if we compare it with the way it was before, it's really reduced.
This is not end of the life. Showing them my remedies or those RVs tubs that I'm using this, so they should follow this program because it is not end of the life for me.
Mimi pia nimejitolea sana kwa sababu nimeona kuwa kule nyanjani ambako nafanya na hao clients kuna shida nyingi, watu ni wagonjwa, watu hawataki kujitokeza. Sasa ni sisi tupigane na wao ili kwamba wajikubali kwa sababu ya stigma sana.
Pia yeye atajiweka wazi. Na nimeona kubwa ina muhimu wa kujitokeza na kuelezea wenzetu ili nao wataweza kujua kumbe kirusi kiko katikati yetu na tunaishi na kirusi, na ukiwa na kirusi sio mwisho wa maisha. Na pia utaweza kusaidia wale katika community kupunguza ile stigma.
How many of these individuals would like to be a community health worker 5 years from now?
Wangapi wangependa kuendelea kuwa wahudumu wa afya miaka 5 baada ya leo? Like all of them.
Your courage and initiative in doing this work in the community is absolutely critical to making progress. We make progress when we have people who are willing to stand up and be leaders, and we're happy to be in your presence.
I was a district medical officer in Ghana, and I was called in the middle of the night to see a patient. She had ruptured in her uterus, and the husband is sleeping on the bench. And I got upset, and I said, while your wife is dying, you are sleeping. He rode 12 hours on a bicycle with the wife, so he was exhausted. And it was too late for me to do anything, and the woman died.
The connectedness between the health conditions of the people and the rest of the economy and the political scene is just overwhelmingly evident in Kenya.
We have a lot of medical expertise, and we know how to address and deal with many of the key issues. What's really a challenge is the underlying fundamental ability to govern and administer not only the health network, but at a larger sense, the governance of this country and of other countries. This is not a unique place.
We have a big problem in Kenya and Africa with counterfeit drugs, which threatens our medical system. The only effective way by which we can deal with counterfeit drugs is to have a strong collaboration between us and drug manufacturers, internally and externally.
As health professionals and as public health people, we tend to look at health being an isolated condition, but in Kenya you can't help but see the profound relationship between health conditions and governance, the effectiveness of governance, the accountability of the government to its people.
However much help we get from outside, we shall not go far if we do not establish these strong institutions.
Unless there is a political security in place that enables health to be addressed, then we're unlikely to make much progress in these issues. We're not going to infuse some certain medication to fix one thing without initiative and leadership on the part of people from top to bottom.
community health worker serves as the link person for all these resources that are available in the community.
The organizers, the community health workers, are providing almost a sort of mentorship for the people in these vulnerable communities that they're working with.
Really, we are sort of the catalyst in this whole process, because it is up to us to go out there and see how we can be able to collaborate and establish a linkage.
What's impressive about these workers was their commitment to the community and the sense of ownership and empowerment and leadership.
Well, I was energized to see this younger group of clinicians, nurses and doctors, who really took pride in their facility, took pride in how they work, being very creative and innovative. So that gave me hope that this generation that's being educated here has a desire to change the way care is being delivered.
Most of the programs that go on are run by the community. Young people who are here, they're from this community. It makes the community feel like this is one of theirs and they will do anything to guard it.
They are the program themselves, and their relationships with these individuals is something that's incredibly inspiring and something that has a follow-on impact in society as these people take those skills out and into political life, into civic life, and to give back to their community.
If you give ownership to the community, then you're set to go. You just know that everything will go well.
Gimoti more,